You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
An emerging bacterial lung disease plagues people all over the globe, and hundreds of thousands are diagnosed with it in the U.S. alone. NTM lung disease may be caused by soil or water, something naturally occurring in the environment. Hello, I'm Patty Tripathi, your host of Breathe Easy for the American Thoracic Society. Terry Green Sterling, who's a longtime Arizona journalist, a few months ago, KJZZ Public Radio in Phoenix published Terry's project on non-tuberculous microbacteria, or NTM, lung disease. And joining us is also her treating physician, Dr. Charles Daly, the chief of the Division of Microbacterial and Respiratory Infections at the National Jewish Health, and a professor of medicine, and the chief research officer for the Bronchiectasis and NTM Association. You are based in Denver, correct?
Yeah, that's correct.
A lot of hats you wear there, including being Terry's doctor, who's in Phoenix. Terry, your journalism project called Breathless was supported by the Pulitzer Center, correct?
Correct. Yes. Thank you.
And it documents both clinician and patient perspective on NTM and those living with this disease. You write about symptoms like extreme fatigue, coughing, weight loss, and night sweats for 3 years before you were properly diagnosed with NTM lung disease and bronchiectasis, which often go hand in hand.
Right. First of all, just let me add that the Project Breathless was published and aired on KJZZ Radio in Phoenix, so you can find it there if you're interested. Yes, my story is very typical of many with NTM lung disease. I had these symptoms that could have really been anything, and my doctor diagnosed it as allergies, but the allergy medicines didn't work. And my doctor said, well, maybe you might have valley fever, but I don't know. He never tested me for valley fever. So I got sicker and sicker. And ultimately, I went to a different doctor which led to the diagnosis, the dual diagnosis of bronchiectasis, which is a widening of the airways and makes it very difficult for the lungs to clean themselves. And also NTM lung disease. These two things go together very often.
And you live in Arizona. Your treating doctor is here and he's at National Jewish Health in Denver. And why did you go to him?
I went to Arizona doctors for about 3 years, and I felt that I was getting sort of one-size-fits-all medicine. I didn't feel I was getting the individualized treatment that people with NTM lung disease really need, because every case is different. So I looked for NTM specialty centers, and I found one in Denver. So I went to Denver, And that's what happens with NTM lung disease. You get weird throat things. So I went to Denver, and I was assigned Dr. Daly. It was just luck of the draw. I was really, really lucky.
Okay. You go through a disciplined and rigorous routine daily to manage your disease. It's a progressive lung disease, and you are not on any medications right now, unlike others.
Sure. But I mean, again, this is a very highly individualized treatment that I get at National Jewish Health. And I'm not taking medicines because I'm not there yet. NTM lung disease has different species of bugs that can get in the lungs, and I have a very slow growing species. Unlike others, it might be fast growing. So I want to, caution everybody, just because I'm not taking medicines at this moment, I may have to take them next week or next month, or maybe in a year. It's nothing that I'm doing. It's just the way the species is growing inside me. And I get checked every 6 months to make sure that, to check the progression of these diseases that I have, NTM and bronchiectasis.
I'm excited to introduce a new benefit. ATS Now is a multimedia platform that's AI-driven and allows you to search ATS content for what you need to learn about and know more, whether it's ATS conference material or webinars, etc. It's really tailored to your needs and when you need them. It's like Netflix for pulmonologists.
And Dr. Daly, what is NTM lung disease? Unlike tuberculosis, it is not contagious. Soil and water environmental factors are the root cause?
Yeah, so NTM, non-tuberculous mycobacteria, they're related to two more well-known mycobacteria, tuberculosis and leprosy. They're in the same genus. There are about 200 species, so it's a complicated field. You need to have a good laboratory to be able to tell the clinician which species is being isolated from our patients' respiratory specimens. And the good news is most of them don't harm us. They are, like you said, they're in water, they're in soil, they occur naturally in the environment, and they're ubiquitous. Basically, everywhere that's ever been tested, you're going to find some amount of mycobacteria. And, in general, they're not very pathogenic to humans, meaning they don't generally harm us, but they can. And typically, they look for a weakness either in the immune system or some structural lung disease. Terry mentioned bronchiectasis. Probably about 80% of our patients have underlying bronchiectasis, and the rest of them have COPD or some other form of lung infection. So you breathe them in all the time. We probably breathe them in every day of our life, but they don't harm us unless they get in there and the lung cannot clean itself, and they get stuck in there and they grow. And then, as Terry said, it's quite variable what happens to the patient after that, to the person. Some may be very asymptomatic and very stable, whereas others can progress and develop cavitary disease and require treatment.
Why is it underdiagnosed or misdiagnosed? It was suggested in Phoenix that Terry might have valley fever, which is fairly common in Arizona. I was a journalist there too in my 20s. What are the similarities and dissimilarities?
Yeah, so valley fever is caused by a fungus called coccidioides. This is, as you said, it's in the soil, the dirt in Arizona, New Mexico, up through the Central Valley of California. Same thing, people get exposed to it all the time, and most people don't get sick from it, but it just like NTM is quite variable in what it can do, anything from being asymptomatic to flu-like illness, all the way to cavitary lung disease, meningitis, so a lot of different things. And there's definitely some overlap in the sense that both NTM and valley fever are acquired from the environment.
And how do clinicians diagnose NTM lung disease then? Scan and bacterial species count or identification? Is it curable?
Yeah, so the problem is that you will not diagnose it probably until you get a CAT scan. So that's kind of the first thing. If someone has a chronic cough, they often get mislabeled as having asthma or bronchitis or COPD. But until the clinician gets a CT, they won't see evidence of the mycobacteria, and as in most cases, also bronchiectasis. And once they see that, then they hopefully will know the next steps, which are to collect sputum cultures. And if you can't get sputum, a bronchoscopic specimen would do. And that goes to a lab. We can grow the organism. And then you mentioned species. So of those 200 species, it's important that the lab can tell the clinician which one it is. It may be one of those that we like, that's just not hurting you. We don't have to worry about this, versus this is one we have to be concerned about. And the treatment varies depending on the species. So that's another reason it's important to understand which one is being isolated.
And there's some controversy surrounding that because it could recur.
Yeah, recurrence rate, unfortunately, are quite high. You asked, is it curable? Again, that depends on which species we're talking about. For something like Mycobacterium avium complex or MAC, yes, we can cure that. But recurrence is very high, anywhere from 25 to 50% of people. They go back to the same environment and they pick it up again sometime. They may pick up a different species, but it could be the same one. So recurrence is high. That doesn't mean we shouldn't treat, because if someone is progressing and we treat, we slow the progression at that point. hopefully improve their symptoms. But yes, they may get it again.
Terry's story says it was very well written that the number of cases is skyrocketing. Is it because it's being diagnosed properly, or is it just happening more because of the environment?
Yeah, I mean, over the past few decades, we've been seeing increases in pulmonary disease. Around 8% per year has been reported in a couple of different studies. And that's quite impressive, for a disease to be increasing 8% per year for over a decade. We don't really know why. A lot of things have occurred over that time that might increase the ability to detect this. One is we're getting more CT scans than we ever did before. If you go to an emergency room, there's a good chance you're going to get a CT scan. And then we'll see the nodules or possible cavitation, and then we'll send the specimen and we'll make a diagnosis. We hope that awareness is going up. We've all spent a lot of time trying to educate our peers. And we've had new drugs come through clinical trials, also raising awareness. So the other things that have happened is probably our exposure to aerosols that are contaminated. If you go back 50 years ago, we'd take a bath probably every few days, but now we shower every day, sometimes at the gym, So we have a lot more exposure than we used to have. We've also changed our water temperatures in the home. We've lowered them to save energy and prevent scalding, and that actually increases growth at that lower temperature. And the final thing is in our homes, we went from copper piping to PVC piping many years ago because of the cost, but PVC allows biofilm to develop, and these things live there. So they get into our home and our plumbing and our fixtures, and they infect it, and that probably has increased over time.
So clinicians would, the way to diagnose it is for a scan and the bacterial species count or identification, correct? That's what they should be looking for to prevent misdiagnosis or underdiagnosis.
Yes, that's correct.
Okay. And the new drugs in the pipeline you mentioned?
Well, there aren't enough, I'll tell you that. I mean, in the past few years, we've had several clinical trials treating different species. Mostly they were aimed at treating MAC, which is the most common NTM to cause pulmonary disease. But sadly, 3 trials had to be stopped because it wasn't working. And, we hate that. And it takes so long to get a drug to a clinical trial and then for it not to be working, we have to stop the trial. Others will be starting, though. We have we're expecting to see some new trials starting. There's one starting this year treating a different organism, Mycobacterium abscessus. And we believe next year there will be another 2 or so trials that will be beginning. So we have hope. We just presented at ATS, by the way, trial results called the Encore trial, in which we used a drug, which is an inhaled liposomal amikacin, or ALIS, and it was quite effective in treating MAC. And hopefully that will also be available in the near future for treating people who are just starting therapy for MAC.
Dr. Daly, you mentioned bronchiectasis and NTM Association. And what is its care center network?
Yeah, so the care center network is a really important paradigm change in this country. So it was January 25, we started a new bronchiectasis and NTM association. It sits and is housed within the COPD Foundation, but it's actually we have our own association and leadership structure. So what we're trying to do is open 100 plus clinics across the United States, trying to get them in every state. The bigger states will have more than one that will follow very similar protocols in how we diagnose and manage bronchiectasis and NTM. So we're up to 62 already, just barely over a year old. And by next year, we hope we're getting up towards 100. And then part of my job as chief research officer for the association is to take that clinical network and spread research across all those sites. So it's really an exciting time. I think we'll improve the diagnosis of bronchiectasis and NTM, and I think we'll also improve treatment by trying to use evidence-based protocols across the country.
And just quickly, valley fever, we've known that is in common in Arizona. Is this NTM usually occurring around the globe in warm weather environments, or is that not established?
And NTM tends to like hot, humid areas. So if you go to the southeastern U.S., you'll see very high rates there. Hawaii typically has the highest rate in the U.S., and it's similar throughout the world. But there are species that like arid. So if you go to Arizona, there's one called Mycobacterium simii, which is one that doesn't always cause disease, but when it does, it's hard to treat. And then if you go into to more colder climates, there are other species that tend to predominate. So it does vary based on the geography.
Terry was mentioning she was coughing up blood, which must have been really frightening. Terry, I read your long and thorough investigative piece. This Project Breathless reveals intimate, and some might even say gross details of managing NTM. Why did you choose to go public with your story?
Well, I can tell you that the story, again, you can find it on the Pulitzer website or the KJZC website, the Pulitzer Center. So the reason I decided to go public, and you will read all the details in the story, is because this is an environmental disease. It's growing across the globe. Arizona is a hotspot. We have a high incidence of it, and very few people know about it, and they're being misdiagnosed, underdiagnosed, or completely ignored. And I wanted to reach those people and the clinicians who treat them, just to gain more understanding and to try to spread the word, because this is a serious disease if it's not, if you're not monitored and not treated.
Anything else to add before we go, both Dr. Daly and Terry Green?
Well, again, please go to the story. It's called Breathless. It has a radio component, and it has a very long form piece, as well as a beautiful Spanish translation. And you can find it at the Pulitzer Center, or you can find it at kjzz.org, or my website, terrygreensterling.com.
You got to plug that in there. Okay, thank you so much, multiple times. And thank you both. And did you have something to add, Dr. Daly?
Well, just, for my colleagues out there, just think about NTM and your patients who have a chronic cough, maybe fatigue, weight loss. These are the kind of red flags for us. And the next step is to get the appropriate imaging. And then hopefully, if you see the appropriate findings, then you'll work the patient up. And if needed, you can always ask for help.
Thank you for enlightening us, both patients and clinicians alike. Have a good day.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.